and welcome into To Your Health. You know, over this past couple of years, we've seen an awful lot of things happening in our country. A lot of them even involve gun violence. And normally when it's happening, we find out that perhaps the person that perpetrated the crime had some kind of a mental disorder. And we wonder, well, what's happening, or how are we addressing this in the United States? Well, we're very lucky in Montgomery, Alabama to have two organizations that have come together, Envision 2020 and the Source, what do they call it?
SummaSource.
SummaSource at AUM, and this is Linnea Conely, right?
Yes.
I got the A in there right. Lynn Beshear, and you and I have known each other for. Lynn, actually, I think I've met you a time or two before with some things out at AUM. You guys are very active in the community. But basically, you folks are going to be putting together a mental health conference at the end of March, and it's for who? Just open to the public in general?
Absolutely. We very much hope that the public in general will come. We have an excellent speaker coming. We're very excited about that. Patrick Kennedy, former U.S. representative from Rhode Island, a member of the Kennedy family, who himself has a serious mental disorder. He is bipolar, and he has had some substance abuse issues. And so he has been very vocal and a leader in the country about this, and we feel very fortunate to have a person of his caliber with his expertise and his bully pulpit of his family name to come to really start this conversation in Montgomery that began about 3 years ago now, when Stephen Reed approached Envision 2020 about his concerns as a brand new probate judge about all the people with mental illness that he was seeing in his courtroom over and over. And he'd only been in office 3 weeks at that point.
Well,
so,
I remember Reese McKinney had the same problems when he was in there. Yes,
every probate judge in the country does. And so the good news about it is that he approached us as the neutral convener to begin this conversation. We had a mental health conference in 2013, a smaller scale. We had Dr. David Satcher, former Surgeon General, here to really begin that conversation. At that point, I reached out to AUM because Envision 2020 is a two-person office, and our job is to be the champion for this issue, to bring the right people to the table, and that is what we have been able to do. And we have a very impressive list of leaders involved with us, from the hospitals, law enforcement, chief of police, sheriff. So we're very excited to open this conversation because the biggest barrier to care is the stigma.
Absolutely.
And the fear to either admit that a person has a mental illness or that a family member does. So we hope to remove that barrier to open this conversation up community and region-wide and actually statewide.
Good. That'd be wonderful. Linnea, how is AUM basically involved in this thing? Are you helping put the conference on, or?
Yes, part of our organization is actually handling all the logistics of the conference, and then another part of it that I work with, SummaSource, is handling more of the tactical aspects of it, making sure that we have the right speakers and working on the agenda and making sure that the topics and the research behind what is going into the conference is really going to get the conversation started and going where we need it to go.
Yeah, we were mentioning the fact about mental health, and it just seems like it's kind of a hidden thing. As you mentioned, Lynn, we try to push it underneath under the carpet to an extent.
Well, we do, and the approach that we are taking to solve this issue is what we call collective impact.
Okay.
I mentioned earlier that Envision 2020 is the champion, and AUM, Linnea, and Jeff Blansett particularly provide the backbone services, the research, the facilitation. It has been a wonderful partnership. And between the two organizations, we can pretty much blanket the community to get the right people at the table. And that's what is really important. Our mission is not to solve mental illness. That is a problem that's never going to be solved. The mission is to create a sustainable, coordinated system of care. And so we believe we're well on our way, and we are bringing into that work this very high-profile conference to, we hope, continue the conversation, elevate the conversation, propel the work forward a little bit more quickly to create this system of coordinated care.
And you know, you mentioned something earlier, and our viewers may be wondering, why did you bring up this thing about the probate office and the probate judge? The probate judge, one of his jobs, because we think about the probate, just get your driver's license, your license renewed, but they have to intervene and they have to certify that somebody does have a mental problem, and don't they?
Yes, they do.
Yes.
And we're actually exploring a wonderful new way to do that through telemedicine, where patients will not have to be removed from the hospital setting, where telemedically they can connect with the courtroom, with the probate judge, with the healthcare professionals there and the legal professionals, to avoid having to just transport a person who may be sort of fragile in where they are with their treatment. So we're excited about the exploration of that, and hope that that can come to fruition in time.
And basically, mental health, like many other addictions or diseases, what you want to do is just control it.
Exactly.
It's not going to ever go away, but if it can be controlled, then a person can live a very useful and fruitful life in society. The dates of the conference?
March the 30th.
Okay.
We will leave the website information with you so that you can include that. The cost after January 31st to apply will be, or to register, is $129.
Okay.
That includes the meal. It's at the Renaissance Hotel here in Montgomery.
And it's 6 hours.
Yes.
It's 9 o'clock in the morning till about 3 o'clock in the afternoon. So it's going to be jam-packed, full of good speakers. It's good for professionals. Will they get CEUs for attending this?
Yes, they will.
Okay, so professionals will get CEUs, and then also if you're just interested from the general public, it's good also.
It absolutely is. The Mental Health Commissioner, Jim Perdue, will be one of the speakers.
Good.
And we have an exciting speaker coming from Texas as well to tell us about what they're doing down there. So we are looking forward to a great day.
Well, Lynn and Linnea, I thank both of you for this wonderful conversation, and it's something that's very much needed. And just remember this, the conference is right around the corner. If you have anybody, and I know you do know some people that may need some help, this is a great way to find out about all the help that's available in our area. We'll be right back right after this.